One of the results of the spotlight on long-term care across the country has been a deeper interest on the part of the federal government to be involved in seniors' care. You and I both know that there's always these jurisdictional disputes. Currently, the federal government spends about or pays for about 25% of health budgets across the country. There's a big argument to be made that that's not enough. In 2017, when we negotiated the health funding agreement, there was a separate tranche for home and community care, which was a way of the federal government putting money in and getting some of their objectives met. Now we see them approaching long-term care with national standards, $3 billion over 5 years. But of course, that's going to depend on provinces and territories coming to the table and being willing participants. What's your view on national standards, and will British Columbia engage with the federal government to take advantage of this interest on the part of Ottawa?
I think the short answer to that is yes. I would say, but it just shows $3 billion, over 5 years. You'd be familiar with this as Minister of Health. Thinks over 100 years, that would be a lot more, I think, probably. $3 billion over 5 years is basically $65 billion a year for British Columbia. And in the context of the health budget and what we spend on long-term care, I would never say no to that. But I think if you're talking about the raising of national standards in terms of staffing and long-term care, the federal government will have to come to the table with more than that. And I think everyone understands that. So I'm open to talking about anything that improves care standards and that gets them involved and gets long-term funding from BC. Of course, it's my position, and I think it was your position as Minister of Health, that the best way to do that is through the Canada Health Transfer. And BC and the Premier of the day, Christy Clark, and you, when they changed that model under Mr. Harper's government in 2014, when they changed the formula in a way that disadvantaged BC, because it didn't reflect on the number of seniors here, the demographic conditions here, they changed the formula. BC objected profoundly then, and that decision was made, as you'll remember, without real consultation by the government. They just made it. And BC, it's cost BC significantly, both under the previous government and under our government. I think the best way to do that is through the Canada Health Transfer. But I'm not stuck on things. Like, I think we have to work through these problems. The federal government talks a lot about things, national pharmacare, there are proposals for national dental care, now increases in national long-term care standards. But I think these discussions need to be, especially at this point in the occasion, really frank. If we want to raise care standards, if that's the goal, then the federal government, which currently contributes 22, 23%, simply has to raise that. And I'm prepared, any day of the week, Sunday night, Monday morning. Our last federal provincial meeting on health started at 6 a.m. BC time, any time of day to sit down with them. If we can take some steps to improve long-term care and provide permanent funding, to talk about any of those things. I'm not worried about the jurisdictional question, but I am worried about the need to advance long-term care. But I think you pointed to something earlier where I think the federal government can play a role, and that is on health human resources. I think they have a critical role to play, as do the care providers and others, in that question. That's a fundamental question for the future that goes beyond the debate about money in these questions. And the federal government needs to play a role in that. And they haven't really in a serious way over time. And they need to play a role now. And again, if they want to play a role, they want to share, I'm happy to share, as long as we make progress for people.